Hi, guys. Welcome to another episode of Natural Fertility with Dr. Jane. Today, I'm joined by one of my practitioners, Dr. Elissa, and we are going to talk about autoimmunity today. Welcome back.
Hi, thanks for having me.
Yeah, the last episode we recorded was the #1 download podcast for the month. So we have a lot to live up to.
Big shoes to fill here.
A big shit, yes. But it's good. It's funny because Dr. Nicole talks about that all the time. She's like, oh, I love this little internal competition. And
Yeah.
I do too, because it's like if we keep pumping out good content and it's really helpful and you want to listen to it, we are happy. That's what we're trying to accomplish. So we're going to talk about autoimmunity and tell people, why we're talking about it today.
Yeah, trying to hit another hot topic here for sure.
It's very hot.
Yes. Autoimmunity. It feels like the last couple weeks of, taking on new clients, it's been presenting itself a lot. So a lot of autoimmunity and ties to the fertility space and, fertility and miscarriages, loss, all of that stuff. And how there's not really as much understanding around kind of the why behind it. So trying to look a little bit deeper into how that's impacting your fertility and what can we do to address it.
Yeah. I think I actually got fired up on the live because someone said, the sperm is normal, but he has 1% morphology. I'm like, so which one is it? Is it the sperm is normal or is it that he has 1% morphology? And I think this happens with autoimmune disease all the time. It's like, it's unexplained infertility and I have autoimmune disease. It's like, well, which one is it? Is it unexplained infertility or do you have autoimmune disease? Because if you have autoimmune disease, that is the explanation to your fertility struggles. So we want to break that down to help you understand. And this is why you were fired up, because your patient was coming to you and she was like, I'm having glosses or I'm having all of these symptoms. And they are just, you tell your patient's story. You can tell it better than I can.
Yeah, so she unfortunately had a first trimester miscarriage and been trying probably 6 to 8 months, I believe, since to get pregnant again, and
And how
hasn't been
long did it take
happening.
her to get pregnant the first time?
Very quickly.
Okay.
Happened very easy for them. They weren't necessarily trying, and so they were a little bit, taken aback that now that they're trying again, it's not happening for them. And so before I even ever met with them, start looking through the past labs and things that they've had, which they went out and did on their own. They ordered lab testing on their own, are looking into it a little bit deeper because she was told that she was fine and that just go and try to get pregnant again. That one miscarriage doesn't necessarily mean anything. And then looking at her labs, I was getting really fired up because, she's got a positive ANA and she's got some thyroid stuff going on and just a lot of things that points back to that could equal the miscarriages. And it really
The reason that
fires
you're
me up.
struggling now. Yeah.
Yeah,
And the reason that you're struggling now.
and why you're struggling, the second time around to make that happen. I mean, not to mention the trauma of the miscarriage. That's a whole nother conversation. But yeah, it's frustrating.
I'm really glad that she was proactive and she went and did the lab testing on her own. It's frustrating that she has to do it on her own because, I always say that the labs are only as good as your interpreter. And so if you're the person that's running your labs and you don't have a medical degree, or you don't have, you've never looked at these labs before, you're just kind of punching them into ChatGPT, the types of questions that you're going to ask the bot will give you the answers. And so I'll use ChatGPT, but the type of questions that I'm going to ask and how I'm going to get it to look at certain research and I'm going to plug in certain papers, I'm going to get very different answers when you don't know that information. And so then we can go down some really deep rabbit holes or completely not avoid something, but just have a blind spot that we don't know about. So I'm really glad that she's doing it. And when I had my miscarriage, between my kids, when my doctor was like, yeah, I have 3 more miscarriages. And I was like, I'm not doing that. You want me to have 3 more miscarriages if it takes me about 3 months to conceive, which is quote unquote normal. And then you have a miscarriage at, let's say, 8, 9, 10 weeks. So that's another 3 months, and then it takes you time to recover and then pregnant. I'm like, that's like 2 years. You want me to wait for 2 years to get some kind of lab testing done? That's bananas. Like, no.
Mhm.
So that's
Mhm.
why we're here.
Yeah. Or even getting the lab testing done and having somebody interpret it, but not through the fertility lens. So they're looking
Yes.
at it and maybe you're getting good information, but you're not getting the information to lead you down the path, you know, to meet your goal of getting pregnant.
Yep. Yeah, absolutely. And that happens all the time. I think we see that in the group membership in our Fertility 101. There is so many people taking an insane amount of supplements and even drugs like antibiotics or antiparasitics, antifungals. Um, and I look at some of those protocols and I'm like, I'm not sure what's trying to be accomplished here. Like, this is
Yeah.
very overwhelming.
Mhm.
Uh, I'm not sure that I would do this, and it's like, I don't want to step on anybody's toes and I respect other people's work. But from the fertility lens, this is a lot. And I'm not sure.
Mhm.
And there's these pieces that are missing. So I'm glad you pointed that out because that is important.
Yeah, absolutely.
Let's talk through people. Like, first question, this is kind of how I want to break it down. Let's talk about, how do we actually get a diagnosis of autoimmune disease? Like, how do we know if that's something that we have? How is it connected to fertility? Or let's talk about how it impacts the fertility first. Then we'll talk about the diagnosing and the testing, because that's a deeper rabbit hole. And you and I like to go into those. And then we'll talk
Yes.
about treatment approach.
Yeah.
How is it connected? Why does autoimmunity impact fertility?
Yeah, so a few different ways that it's impacting. So having the elevated cytokinase, the implantation risk of miscarriage increases a lot when you have that. The poor immunological, say that fast 3 times,
Yeah.
tolerance with the embryo, the embryo has to implant. That can impact implantation, ovarian function. It can also impact sperm health. Um, lots of ways that it's impacting fertility.
Yeah. I think what we have to remember is, when we have autoimmune disease, we have high levels of inflammation. And if it's the simplicity of what's happening is that the body cannot recognize its own tissue from foreign tissue. And in pregnancy, first of all, the sperm is foreign tissue, like it's foreign DNA. So the egg has to accept the sperm. That's a big component. And so either one, so the male partner or the female partner having autoimmunity, there's microbiome shifts, and there is a microbiome that's associated with the white cervical fluid, with the sperm, and the ability of those to mesh and then to be able to travel all the way up. That's really important. And then the embryo, what you were saying, in implantation, the embryo is foreign DNA. So when your own immune system is super dysregulated, the it's not going to be able to downregulate to accept this foreign DNA. It's actually just going to elicit an immune reaction towards that, because it
Hmm.
can't tell. It's already confused, if you will, from your own tissue versus foreign, and then the ability of the system to be really flexible changes because it's just inflamed. It's on high alert all the time.
Yeah, it's prioritizing different pathways.
Yeah. And then, like you said, with the ovarian function, well, when we have high levels of inflammation, ovaries are super sensitive to oxidative damage and inflammation. And that's the first thing that we do is the more inflammation we can decrease, the better the ovarian function becomes.
Absolutely.
So it is not unexplained infertility. It is autoimmune disease. If you have autoimmune disease and you've been told it's unexplained infertility, it's like, that's the reason you're not getting pregnant. So, let's talk about the testing and the diagnosing, kind of the standard testing first, and then we'll go into some of the functional lab tests that we could do to give us a deeper understanding.
Yeah, so standard testing wise, on a blood panel, you'll have an ANA, or the anti-nuclear antibody screen, which is going to show us a titer. And so you have different levels to that. A good reference point is 1 in 80 and below. could be, a low level, a false positive, or anything above 80, you would want to search for further testing, look a little bit deeper. If you do get that higher result, you would want to then go and look at an ENA screening. So that's going to give you a little bit more specific on which autoimmune disease it actually is. But having both gives us the
Mhm.
idea, right, that it's happening. And then on our side, we would want to go into further testing to kind of find that root cause or that why.
Yeah. Yeah, I love the ANA, ENA, and then we do look into like inflammatory markers, although sometimes inflammation shows up very little,
Mm-hmm.
especially if you have a really good lifestyle, and you are taking
Mm-hmm.
care of yourself and you are taking some herbs already to try to manage the immune system. Um, Thyroid antibodies, I think that's a yes. I've seen thyroid antibodies be elevated, but the ANA is not elevated. So it's not,
Mm-hmm.
it's not an 100% accuracy test, if you will. If you have thyroid antibodies, you have autoimmune disease. Um,
Mm-hmm.
and sometimes you don't have thyroid antibodies, but you have high ANA. And that's where that ENA comes in, because then you're like, okay, if it's not in the thyroid, where is it? Is it in the skin versus like the collagen, the eyes? Like there's different areas, the muscle tissue. There's different areas. This is where the genetics come into play, that you
Yeah.
likely have a genetic predisposition. And this is why we look at family history really deeply. Like I know my mom has rheumatoid. I know that that's
Mm-hmm.
part of my story, and I can do things to prevent the development of that, or I can do things that will speed that up.
Right, right. And I think you talked about this recently too, Dr. Jane, of like, if you have the gene, that doesn't necessarily, mean you're going to, I think it was with endometriosis you were talking about it, but it's like, is it turned on? Like, are you poking the bear? Are you turning the gene on? Are you feeding the problem? Or are you trying to regulate things and look at a deeper level to try to keep that gene turned off? Because just because you have family history or you have a genetic predisposition to something doesn't mean that that's your fate either.
Yeah, absolutely. But it also doesn't mean you don't have to do anything about it. I think this is where people
Right.
get it really confused. It's like, well, do you cure it? And someone actually, I think that was from the live,
Yeah.
someone posted, is like, well, doesn't the surgery cure it? And I was like, only until it comes back.
Until it grows back. Yeah.
Yeah. And then when it grows back, then the
Like,
surgery is curing it again. Like, it's just
right.
a crazy little thought process. We're like, yeah, but the surgery will just remove it and it's gone. And so let's talk about the deeper testing about what are the functional lab tests that we look at to help us understand, why is the body doing what it's doing? Why is the body attacking itself?
Yeah. So, looking deeper, like where is there inflammation, where there could be infection. So, a stool analysis, we want to see what's going on inside of the gut.
Mhm.
A vaginal microbiome is going to be really telling as well to see, infections or like what good versus bad bacteria you're having. Looking at levels like the things that your immune system, the vitamins and minerals that your immune system uses to regulate. So, vitamin D, zinc, selenium, omegas, um, B vitamins, all of those things are very important to see those levels too. And then a methylation panel because we want to see the mitochondria
You can't do
level. And
anything
we,
without methylation.
you can't, I tell all of my clients, I'm like, this one's my favorite because it's the least utilized, but it gives us so much good information. Like when I tell you the amount of like mind blown I was when you introduced that to me and showed me how it worked, like the methylation panel is huge. Like, how is your body detoxing? How is your body creating energy? And I always explain it too. Like, I'm like, okay, I'm back in biochemistry now. And like, I'm looking at all of these
Yes.
pathways. And like, you never thought you were going to use it, but here you are looking at a methylation panel.
Yeah. Yeah. And I'm always reminded, like Dr. Leah Hitchman says this, like, I don't think we fully understand it yet. Like, we have these beautiful
Yeah.
pictures that we have been able to create based on the research and what we're seeing in practice, but there's
Yeah.
still components where you're like, something is not quite right. We're still missing this little
Mhm.
piece of information. And then sure enough, there's another test that comes out and you go, oh my God, this is it.
Yeah.
In the same even with the stool analysis, like the tests that we're running now versus what I ran 10 years ago, like there's been a lot of evolution. And it just goes to show that there is so much that we still have to learn and we don't
Mhm.
know. But the
Mhm.
connection between immune system and microbiome and the gut microbiome dictates, I think, the rest of the microbiome just because it's so influential. So it dictates the uterine, the vaginal, the cervical, the fallopian tube microbiome. And yes, all of those organs have different ones, let alone the skin microbiome, the lungs, the you name it. Like we have certain
Mhm.
bugs in certain areas of the body, and it's fascinating. So if we can get a good look at the gut, and of course the reproductive microbiome, the vaginal microbiome is the easiest one to look at because, like we're not going to get you to, not everyone's going to get a uterine biopsy. Like that's not a fun test to do. And unless you've been struggling for a long time. And what are we looking for? We're still looking for infection. We're looking for what
Mhm.
is causing this infection, histamine reaction. And then usually there's some kind of hormonal imbalance, and whether that's low progesterone, high estrogen, or all of the above.
Mhm.
The goal of this testing is to really understand what is the body telling us? Why is it so confused?
Yeah, exactly.
This is where, um, the conventional system and you were like, "I'm just so fired up and I'm so mad at them." And I'm like, "I know, me too, all the time." But, um, the from the conventional system, they'll look at you and they'll say, "You're oh, it's just your genes. It's bad luck." And what that tells me is they're telling you like, "Sorry, your body is stupid and it's just attacking itself."
Mhm.
And if we have this really deep belief, in our company culture that the body is actually really wise and it's smart. So if it's attacking itself, we need to ask, why is it doing that?
Mhm.
Instead of, oh, sorry, you just got a bad one. The,
Mhm.
factory setting was off. So, and it's then that's your belief. And then you believe that there's nothing that you can do about it. There's no cure, or here's this drug which is what, like a steroid that's just gonna bring down all those cytokines you were talking about? It's like, well, that's not curing anything. And steroids have a lot of negative side effects,
And
a lot.
creating more dysregulation within your body in a different way. To kind of go back on that when you were saying like we're just told that okay, sorry, that's just your fate, or the belief around like I was gonna have it anyways because this is my genetics, I think is overused, and it's told to you not even for things that are genetics. Like working as a chiropractor when I was like actually adjusting, and people would come in and they're like, "Oh, I have low back pain because my dad had low back pain." And I'm like, "No." You're not predisposed to a
That's
herniated
not
disc.
how it
You're
works.
not
Yeah.
predisposed to, degenerative whatever's happening. Like it's overuse in your body. It's how you've treated your body. And it kind of goes hand in hand
It's
there
how
where
you
like
watched your dad treat his body.
yeah, exactly. Exactly. So it's not necessarily going to be your fate, but it's what you do about it.
Yeah. Yeah, absolutely. I think the bottom line with autoimmune disease, when we go and we test, the immune system in the whole body is really overwhelmed. And you get like, I'm very in tune of how I feel when I look at someone's tests. And sometimes I'll look and I'm like, I just start feeling so overwhelmed. And it's like, that's how this person feels. And you could see it because you're like, and this is in the red, and this is in the red, and calprotectin levels, and this, and oh my God, there's this infection, and this infection, and all these nutrients are so low. And you're like, yeah, it starts to make sense why the immune system is not able to recognize what's happening because there's really high inflammation load and really high pathogenic load, essentially, or toxic load that's causing the immune system to just go, I don't know what's what, not to mention the leaky gut and all of that.
Yeah, and then they have a hard time regulating and their nervous system is overwhelmed, and a lot of times it's, correlated to stress and poor sleep, and, when a super stressful situation can trigger an autoimmune response in your body, why wouldn't chronic stress or chronic overstimulation be the same? Where, you work a tough job, or, you have whatever type of stress, chronic stress you have could trigger something. So regulating that as well is super, super important.
I'm so glad you said that because I remember I've made a couple of posts on this a while back, and it's always like, these are the three things that cause autoimmune disease. And it's like, there is really high pathogenic load, which is causing high inflammation. And then the trigger is usually there's some kind of trigger. So there's the high pathogenic load, the high inflammation, and dysregulation, and then this really big trigger. And usually it's chronic for a long time, but the trigger could be good or bad. I've had people who are like, but I was getting married and it was, I was really excited and there was
Yeah.
this trip. And it's like, do you know how stressful getting married is?
Yeah.
Depends on what you're doing. But you're right. Like if it's a single trigger, why can't a slow chronic stress that just kind of chips away at your resiliency cause autoimmune issues? And it's like, and it does, and it can, and we do see it in practice. And that could be the job, but it could also be you're just eating poorly, and then the blood sugar is dysregulated, and then you're not sleeping well, and then you're sitting more in front of the screen, and then it's like, okay, that's a lot, you know?
Yeah. Yeah. And we ask a lot of questions. And like sometimes I ask people questions that I'm like, they think that I'm crazy, but it's all related. It all goes back together. Is like every system is interconnected and every part of your body is intertwined and one can't do something without the other. And so getting to the root and getting to the why and like the background, I keep telling them like it's like the background things that you're not even thinking about do impact that.
For
And
sure. Like the toxins in your water. Like, I know it sounds silly, but it's like if we start to unload some of those things or living in mold, like that's a big
yeah,
deal. That can trigger
huge.
autoimmune disease. And it
Mhm.
does, you know?
Yeah.
So, yeah. Let's talk about how we treat it. So, there's a big connection, like we said, the leaky gut and the microbiome and the vaginal, uterine, all of it is connected. How do we actually unpack it? And, where do we start? What are some pillars in our treatment?
Yeah, so identifying, right? So identifying the burden, if it's some sort of infection, right? Clearing the infection, detoxing the system from it, reducing the strain on the gut lining, so anything that you might have a sensitivity to, even as little as like you said, what water bottle are you drinking out of? Are you filtering your water? What burden, what impact does the gut have? Opening the detox pathways. So when we take that methylation, we're like seeing how is your body creating energy? How is your body detoxing? Where are there missing pieces? Addressing those, and then rebuilding the tolerance. So especially in the gut, like the prebiotics, the probiotics, fiber in your diet, vegetables, protein, all of those are super important. And then trying to keep inflammatory or inflammation down. So whether that's supporting it through the supplements or, the inflammation, like the food, what are you sensitive to? Environmental toxins, so what's causing inflammation around you, alcohol, smoking, all of those types of things create inflammation within the body. And then nervous system regulation, so regulating the
This is your
stress.
favorite.
And yes, I could talk all day
The
about
vagus nerve. We talked about the vagus nerve, and that
yes,
it
go
comes
back
in
and
again.
listen. Go back and listen to the Vagus Nerve
Pump
podcast.
those downloads for us.
2 months in a row. Yes. So regulating that and unpacking the stress, getting good sleep, processing emotional traumas, whatever physical or, emotional that could be for you. Um, a lot of things. There's a lot of things we do to treat it.
Yeah. I think reducing the burden is the biggest. But before we can reduce the burden, we need to understand where the biggest burden is coming from.
It's coming from. Yeah.
And that's where the testing comes into play because, I mean, I have had patients who've already done all of these things. They've cleaned the water, they've done all these things, and they still have autoimmune disease. And so the environmental toxic component is not being more diligent with the environment is not what's going to move the needle for that specific person. But they've
Hmm.
never had, a vaginal microbiome done, or they've never had methylation done, or they had methylation done, but their doctor told them that the functional doctor was like, Once we get rid of the infection, then the methylation will improve itself. And it's like, that's not how it
Yes.
works. So sorry to break it to you, but you actually have to fix the methylation so then the body can overcome the pathogen. And then it's never just one pathogen. And so if we see a bacterial overgrowth, is there also yeast overgrowth? Do we have symptoms and presence of parasites? And sometimes the parasites are not showing up in the stool, but we're seeing them in the blood work, in certain markers that we're looking at, or your symptoms that you're expressing. So there's the hierarchy of treatment, and then making sure that the body has enough energy to actually overcome it. It is also about treating the partner.
Yes.
You share the microbiome, and sometimes the partners are asymptomatic, but they're actually the carriers.
Mhm.
And I see this all the time. And the woman has this really sensitive immune system and he doesn't. So he's like, I'm fine. I don't have any symptoms. And then we look at their labs and it's like, well, you have the exact same bugs she does, the
Mhm.
bad ones, if you will, the pathogens, but her system is in chaos and you're like, okay. We have to clear those pathogens from his system so he can stop reinfecting her. I've seen that
Yeah.
all the time. And that's one of the why I'm like, nope, I'm only seeing couples. If you want to have a baby, we want to help you build generational health, which means having a healthy baby. That means having healthy parents. And I don't care if the male says nothing is wrong. I will find something. And I always do.
Absolutely.
And like, I just don't know
Absolutely.
people who don't have anything wrong, like I don't,
Yeah.
if you live in 2026 on this planet, there's something that you need to optimize. I can
Absolutely.
guarantee you that.
Absolutely. Sometimes it just takes a little bit more digging, but you are sharing everything with your partner. And just because you don't feel yucky because it's not impacting your body as much, everybody processes things differently. And, things lay dormant inside of our bodies. And sometimes we don't even know. Like, we're all carriers of some sort of virus, we're all carriers of something. It's just
Yes.
a matter of how you express it. And people will find sometimes they start a new relationship and they're like, oh my God, all of these things. And it's like, okay, well, now you're sharing. Now you're, figuring out what this person is a carrier of. And so it's really, really important that the couples do this together.
Yeah, absolutely. Um, Last thing I want to talk about is the mental and emotional component of it all, because this is where, and I'll quote Dr. Gabor Maté because he speaks a lot about this. If you have autoimmune disease and you have not heard of him, you should check out his book. And the book is called When the Body Says No. And I think he has another one that's more recent and it's giant. Um, uh, the Myth of Normal, I believe. But Dr. Gabor Maté talks a lot about autoimmune disease, and this is the quote: "The hallmark of autoimmune disease is that the body turns against itself. In people who are unable to say no, their bodies end up saying it for them." People who are not able to say no, the bodies end up saying it for them. So, disproportionately, we tend to see autoimmune disease in women, because we as women tend to take care of everybody else before we take care of ourselves. And that is how our brain is wired in the transition that happens from, being a child through puberty. We start to become in tune to other people's needs because it prepares us for motherhood. The problem is when we tune into other people's needs more than we tune into our own, and we actually are just pouring from an empty bucket. Basically, we're trying to scrape the bottom of, the barrel that's really empty.
Yeah. And especially in the fertility or lack thereof process, a lot of times the women take on that as self and that this
Yes.
process is happening because of them. It's very rarely that you meet with a couple and the guy's like, yeah, I'm the problem, whether they're saying it directly or not. And us as women are taking that on. And so that's the relationship with self and the relationship with your reproductive organs and your body. And we don't realize that that's such a big component of it, but then when you realize that you don't have that relationship with your body, it kind of becomes that aha moment where, okay, yeah, it actually it actually does matter.
Hmm. Well, how do you feel around the cycle? It's like, oh, I don't know. I don't notice a difference in how I feel around ovulation versus how I
Mhm.
feel around in the second half of the cycle or in the first half of the cycle. Or, yeah, I had a patient where um, she had painful periods as a teenager. And like those is how her periods were. And everybody just kind of told her it was normal. That's what she just gets bad luck. And she kind of started being really mad at her uterus because, like, why do I have to struggle with this that nobody else does? And she hated her period
Mhm.
and arguably still hated it up until, 6 months ago when we had the conversation about it. And she actually
Sure.
ended up, of course, getting emotional. But the point was, it's like, how can we get you to love and appreciate this and listen to this as a signal? And I know it's really hard to be like, how can I love and appreciate a painful period? You're not supposed to love and appreciate a painful period, but love and appreciate the fact that your body's telling you that something is out of balance. And then
Mhm.
this is where the system is really broken because the system told her at 14 years old, nope, that's normal. That's who you are. Like, just go on birth control.
Yeah.
As opposed to like, nah, that's not normal. You're already carrying some toxic load. There's already hormonal imbalances. There's already high stress in the body and inflammation. And there's so many things, like if she did that and addressed it and her mom knew how to address it with her
Mhm.
instead of taking to the doctor who then gave them birth control and it was like, okay, I guess you'll just be on birth control. And it's this perpetual women care, like discontinue dis it's like we're not really engaged in our care. We don't really understand what's going on. We're just kind of told what we need to do, and then we believe that and
Mhm.
we take that as the gospel truth. And in reality, it's like all of our patients, I'm like, you know your body better than I do. You will
Yeah.
always know that. Your job is to tell me all the things that you're experiencing, and I'm going to help you make the connections and the dots so you can rebuild your relationship with your body and actually learn how to trust it and take care of it instead of this, like, well, somebody else has to tell me what's wrong. You
Mhm.
know what's wrong. You might
Mhm.
not know how to fix it, but you know something is wrong.
Yeah. Yeah. And that's your body giving you the warning signs. I had a patient tell me the reason why she went on birth control when she was in her teens was because she would get a bladder infection after each one of her periods. And so the doctor's solution was to take away her period rather than
My
teaching
God.
her how to be sanitary during her period or, looking a little bit deeper into why she might be carrying a recurrent infection. And then, 20 years later, she's like, "Okay, I have chronic candida and I can't get pregnant." Okay.
Weird.
Weird. Let's
Yeah.
unpack that.
Yeah.
So, absolutely.
Yeah. Yeah. I think any disease gives us insight into something. And there's a genetic component, absolutely. But usually that genetic component means we've been carrying the genetic burden for a while. And I think, I think about my genetic line and I look at, my mom's health versus my health and the things that I've had to learn to do and undo because of I can see it, but the burden is heavy, and it's not just doing the supplements and the protocols and the testing. It is the mental and emotional work, and like Dr. Gabor Maté says, it's like if our immune system is this first barrier to pathogens. Essentially, once we start developing autoimmune diseases because the boundaries have been broken, and whether that's
Mm,
been broken by someone else or ourselves, and usually we learn to break our own boundaries because, if your parents, because of like people pleasing, or when you were a child, it's like if I stopped listening to myself and I went against my instinct because of survival, AKA I would receive my parents' love and attention, and I then
mhm.
could stay, then that just becomes the norm. And I can't
Yeah.
tell you how many autoimmune disease patients, and I'm not sure if this is the case for your patient as well, but they're usually the really responsible ones. They're the caretakers, and they've stepped into
Mhm.
that role a lot younger than they should have,
Mm,
you know? And they're carrying that burden, and they're still carrying, and there is that then lack of boundaries. And then, of course, there's things like sexual assault or abuse of any kind, really, where
mhm.
your own boundary was broken and we haven't. quite recovered from that.
Yeah.
Powerful stuff.
Yeah. Yeah.
Anything else? Should we finish on this note, or is there anything else?
No, I think that
Mhm,
that's good. That quote,
mhm,
that's a powerful, powerful quote.
mhm.
I like that.
Something to think about.
Mhm. Mhm.
Something to think about. So it is absolutely possible to treat it. I retest my autoimmune patients often because that tells me when we are ready to start trying, and I want the antibodies non-existent because then I know the immune system is not dysregulated, the inflammation is down, and the truth is the infection load is down. The truth is the patients feel so much better and they feel different, and then I'm always like, and this is what it feels like not to have antibodies. So when that
Yeah.
antibody load starts to creep up, you'll be able to catch it so much earlier, and usually it is connected to that infection coming back. And then you potentially you traveled and you caught something. I just spoke to my friend. She went to Peru and she's like, yeah, I got a parasite. She's like, and I thought it was after this, but then, and I'm like, yep, that happens all the time. You travel, you even like just eat or drink something or whatever, and it's boom,
Mhm.
it's
Mhm.
in your system. So it is absolutely possible to treat it. You need to understand what to do. It absolutely impacts fertility. And we need to look at the physical, mental, emotional, and spiritual component when we're talking about this. That's how we really heal it,
Mhm.
cure it, control it, whatever, manage it, whatever you want to, whatever
Manage,
word,
regulate, yeah.
you name it. So,
Throw it in.
mhm. Well, thank you, Elissa, for being here and for another wonderful topic. We hope you guys enjoyed it. And share it, download it. We're in a competition over here.
I guess. I guess.
All right. Thanks so much, you guys, for listening and tuning in, and we'll see you next week.